So we haven't checked in for a little bit about what's going on with coronavirus. So I want to spend a little time today. It's been a weekend. We have another several days of data. We now have more averages and trends to look at. And I want to go a little deeper than just cases and deaths, but let's start there. As of this morning, the United States had more than 5.2 million confirmed coronavirus cases and just shy of 166,000 deaths. Now, remember that in terms of deaths, Donald Trump said through April and May, first he said 15 cases will soon be zero. That didn't work out. In April, May, Donald Trump said, well, we could end up with 50 or 60,000 deaths. Then it became clear it's going to be more. Trump moved the goalpost to 70, 80,000, 90, 100,000. Now it's about keeping it under 200,000. Now, the official death toll at 166. Later in the show, I'm going to talk to you about the actual death toll now really is probably more like 225 because of the uncounted coronavirus deaths. Let me not get ahead of myself. We'll get to that a little bit later. But okay, that we're officially at 166,000. Now, in terms of cases per capita, the states now at the top of the list are Louisiana, Arizona, Florida, New York, Mississippi, New Jersey, Alabama, Georgia, South Carolina, Rhode Island, and Nevada. And what you're seeing is that what early, in terms of per capita cases, were exclusively these blue state hotspots as a result of which states have the direct flights to the source contagion regions. There's been a shift to red states, not just in the total number of cases, but in cases per capita, because now it's about policy. Early, it was about who had the bad luck or timing, is what I guess I would call it, to, before we really knew about the virus, have a lot of direct flights to China and the source countries in Europe like Italy. And it was, Boston, New York, New Jersey area, Chicago, Illinois, the California airports, Rhode Island, by virtue of being very close to Boston, also was hit very hard. Now it's about who's testing, who has guidelines, where are people wearing masks, etc. So now it's about policy. Cases, of course, depend on tests and how much testing you are doing. And as we know, as I told you last week, Florida and California, as examples, were underreporting cases for different reasons. Florida because of the hurricane, California for still some unknown reason. So when you look at one of these examples, let's look at, for example, Florida. Because of the decreased testing in Florida, Florida cases started declining in late July. Except we know why. They aren't testing as much because of the hurricane. But if you look instead of at cases at hospitalizations during the last week, Florida had a record for single week new hospitalizations for coronavirus, just over 3,300. That's more than 500 new hospitalizations per day, including 621 hospitalizations in Florida last Wednesday. That's not what you want to see. And it's another signal of how you can affect cases by not testing, by changing reporting. Hospitalizations are a really important indicator. Now, meanwhile, for political reasons, Donald Trump is talking about every country now is seeing a resurgence. And the reason Trump is doing this is if he can point to Spain is having a wave 2, Italy's having a wave 2, I guess he thinks it makes the United States response look less bad. But there's a few really important things to think about as we look at some European countries see numbers start to climb again. First of all, we've been expecting a second wave since March. This was what doctors thought would happen. Decrease in the summer, back up as we approach fall. In the US, we never even had the gap because when we got down to 20,000 cases per day, most states started reopening, which is crazy. Now, to the other piece, yes, if you look at some European countries now, like Spain, they are seeing a resurgence in cases, but they're immediately putting the guidelines back in place, and people are mostly following them. So when the president points to, we're doing fine because there are second waves in Europe, well, first reaction is, we knew and expected all along that there would be a second wave. In the US, we've been so acutely terrible that we didn't even get a break from wave 1 to wave 2, and we're now approaching the fall ourselves. Secondly, the other countries see the rise, and they put the guidelines back in place. Paris is now ramping back up masking rules and putting measures back in place. Trump points to Spain and France to justify not having taken it seriously, but the problem with his logic is they did take it seriously and immediately are starting to right away. It's completely incoherent, but it's where we are today. And all we can do is deal with it. Real quick, August 23rd is the 15-year anniversary of the David Pakman Show. This is a really big deal. We're on track for 1 million YouTube subscribers this year. Our podcast has grown 40% in the last 3 months, and we're hitting 15 years. So on the 23rd, we will have a huge, very special membership special, which you can be notified of by grabbing a free newsletter subscription at davidpakman.com. This is very exciting. We're doing something crazy that I may even regret. Some governors would probably call the membership special we're planning illegal and immoral, I would even say. But we're going to persevere and do it. So get on our newsletter at davidpakman.com. August 23rd, a big, big day in David Pakman Show history.